Imagine you're a little girl. One second you're playing with your new favorite toy, and the next second you're writhing in the floor in pain. You get to the ER and the doctors know exactly what's wrong with you, right? Wrong. As it so happens, you swallowed not one, not two, not even three little small neodymium magnets known as buckyballs, but 37 of them. They ended up punching 4 holes in your GI or gastrointestinal tract, and you can ask Coach Goff, holes in your stomach are not fun. How did the doctors find this out? Well, they actually didn't. The radiologists did. Radiology is a way to diagnose patients without being invasive, and it really allows doctors to find out what's wrong with you. The reason I chose radiology is because it's something I can see myself doing for the rest of my life and having fun while doing it. Radiology deals with diagnosis. You can say that diagnosis is a small part of the medical field, but you'd be wrong because diagnosis is what begins the medical field and what ends the medical field. Hi, my name is Matt Lee, and this year in ISM 2, I'm continuing my study in radiology. My family consists of me, my dog, my brother, my mom, and my dad. All of the humans in my family like to travel. I wanted to be a cardiologist at the beginning of ISM 1 because I knew that one day I could be cruising down the street in this beautiful Ferrari LaFerrari because cardiologists make $500,000 a year. However, after some career outlook and assessments over cardiology, I found out it's not something I really want to be doing for the rest of my life. I instead chose to choose radiology because a career should not be about the money, but be about loving what you do, doing it for the rest of your life, and having an impact on the world while you do it, and radiology offers that for me. A large part of ISM involves the journey that we take. Michael York once said, "I think that you'll have to believe in your destiny, that you'll succeed. You'll meet a lot of rejection, and it's not always a straight path. There'll be detours, so you need to enjoy the view." Through ISM 1, I've definitely met a lot of rejection. I was one of the last people to have a mentor last year, but I really enjoyed the journey and learning along the way and building the connections that ended up landing me the first mentorship of this year in ISM 2. On my way to become a radiologist, it's definitely not going to be a straight path, and it's going to be a bumpy road. I'm not always going to get what I want, but I need to remember to learn along the way, enjoy learning so that I can be a better radiologist in the end. A large part of ISM is the research. These 3 research assessments kind of highlight what I wanted to show other people about radiology and how my research affected me the most. One of the articles I read was called "Radiologists Face No Elevated Risk of Radiation-Related Mortality." A common misconception among people is that radiologists are exposed to a ton of radiation. Whenever I tell my relatives that I want to be a radiologist or family friends, they always say, "Are you sure you can get cancer very easily? It's dangerous, you better be careful." However, that's just not the case. This article conducted a study with 44,000 radiologists compared to 44,000 psychiatrists, and they tested the health of the radiologists and the psychiatrists. In the end, there were no more radiation-affected illnesses in the radiologists than there were in the psychiatrists. It was about the same. And in fact, the radiologists were overall more healthy than the psychiatrists. A way I can see this, how radiology is very safe today for radiologists, is by these badges that they have in hospitals. They actually detect how much radiation you're getting and make sure it's under the recommended dose. The next article relates heavily to what I wanted to focus on last year and this year for my original works and final products. I learned through this article that a lot of radiologists are actually punished for making understandable errors that any radiologist could make, and that's why they're scared to report them. There are 3 possible solutions that the article brought up, but I really think it needs to start with not punishing radiologists for making understandable mistakes. The first solution was called the checklist solution. So like pilots who fly planes, they need to check off a list before they take off and make sure everything's in order. So for example, my mentor, Dr. Connor Riley, if he gets a lumbar MRI of the spine, what he does first is look at the vertebral bodies and then the disc space, and then the soft tissue like the subcutaneous fat, the kidneys, and the muscular structures. Through this checklist solution, it's very easy to be organized and to limit the errors that a radiologist can make. The next method is computer-aided detection. I thought this was really interesting because computers can actually highlight areas of interest that the radiologist might want to look for where there are anomalies. And this can help radiologists diagnose patients a lot better, but it can also be a downfall because radiologists could become reliant on computer software and not continue their education and practice hard cases like they normally do. The last method is the double check method, which is unfortunately the least used method because medicine today has become more of a business with the idea that there should be more quantity over quality. In the double check method, 2 radiologists would read the same scan and then their reports would be collaborated to combine into one report, and the report would have the reliability over one radiologist reading the report because there would be 2 sides who would eliminate errors on both parts. This is economically inefficient because you have to pay both radiologists for the same amount of time as it would take to read 2 scans, but they're actually reading 1 scan. The next article answered the question, has technology ruined the radiology profession? In some ways, I think that technology has definitely made it worse for radiologists, but in some ways I think it can also benefit the patients in a numerous amount of ways. For the first thing that the article talked about was PACS, or Patient Archiving and Communication System. Whenever I go to a radiologist in the imaging clinics or in the hospital, I always see them use PACS. Through PACS, they can pull up images from a patient's past, or they can send images from the hospital to outpatient clinics or outpatient clinics to hospitals, emergency rooms. They can access all sorts of files from anywhere that's connected within the PACS system. So this makes it a lot easier for radiologists to dictate scans, because if they can look at a past scan of a patient, they can see if there's been an improvement in the condition or further degradation of the patient. However, what this does is raise the expectations for radiologists. Since a lot of physicians know that the radiologists have it easier now with the PACS system, they think that the radiologists can read scans, and they want the quantity over the quality, like I mentioned before, in the business side of healthcare. This is unfortunate because the radiologist has to sacrifice a lot of their effort and time to get these scans out, and the workload is becoming a lot harder on them because of PACS. Another type of technology that's kind of scary to me actually is visual pattern recognition. Like computer-aided detection, visual pattern recognition can locate areas of anomalies in a scan. But with visual pattern recognition, the computer can actually tell sometimes what the anomaly is. In essence, it can read the scan without the radiologist. For example, they can see pulmonary embolus in lungs on a pulmonary CT scan. This is scary because in the future, computers might be able to take over the job of radiologists, and it's actually astonishing to me that I might be going into this field, and in college, computers might be replacing my future career. The second part of ISM is mentorship, and I was lucky enough to start very early this year with Dr. Connor Riley. Dr. Riley graduated from the Texas A&M College of Medicine, and he decided to specialize in neuroradiology at UT Southwestern. What neuroradiology covers is radiology of the spine and the brain and the nervous system, all the nerves connected to the spine and the brain. He works with a group practice called Radiology Consultants of North Dallas, or RCND, and they have a contract with many hospitals and imaging clinics like Preferred Imaging and Medical City Dallas. Some of the things that I learned from Dr. Riley that really stuck out as most important to me were that I want to specialize just like him. He specialized in neuroradiology, and since I'm shadowing him, I'm actually considering specializing in neuroradiology because of how much I've learned from him this year. I want to perform some procedures like him as well. For example, he does injection of contrast into hip and shoulder joints before patients get scans to see the joints better. I've learned everything almost about the spine and the brain this year. At the beginning of the year, if someone came up to me and said, the patient has foraminal narrowing with retrolisthesis, I would have been like, what the heck are you talking about? But now I can safely say that foraminal narrowing with retrolisthesis means that the holes in the bones have narrowed for the spinal canal, and the vertebral bodies are slipping in relation to the vertebrae above and below it. I also learned about the need for communication improvement, especially between the radiologist and the physician, which leads me to my original work idea. For my original work, I wanted to create something that could benefit all three parties involved in the radiology process: the radiologist, the referring physician, and the patient. I also wanted to elaborate on last year. Last year, for my final product, I created a survey that would help benefit the patient and radiologist communication that leaves out the third party of the referring physician. I also wanted to address the issue that Dr. Riley brought up to me about the communication between radiologists and the referring physicians. So my original work idea is to create a communication protocol for the radiologist and the referring physician. The radiologist and referring physician would have two separate protocols they would follow. It would be kind of a flow chart diagram where they could go through in an organized manner in order to effectively communicate everything that needs to be gotten across through the process of diagnosis. It's definitely not going to be easy. I still have a lot of research to do, and Dr. Riley is going to be there to help me along the way, and in the end, I'm not going to let him down. Thank you.